name is Jovian Bunawan. I'm a project manager dairy protein at NIZO. I would like to start by thanking the American Dairy Products Institute for inviting me to speak at the Dairy Ingredients Technical Symposium. The theme of sustainable dairy ingredients, growth through innovation, fits very closely with NIZO's own area of activity. Today, I'll be speaking about the use of dairy proteins in medical nutritional products, specifically high-protein medical oral nutritional supplement or ONS drinks. Clinical nutrition is a big and growing global market, expected to reach over $87.5 billion by 2025. In 2018, it was already worth almost $51 billion, including $10.5 billion in the US alone. Globally, infant nutrition accounted for almost $31 billion, and adult nutrition over $19 billion. We have seen growing demand for pediatric medical nutrition, especially in the countries such as China and India. But the population surge amongst baby boomers and millennials, as well as ever-increasing life expectancies, ensures that the demand for medical nutritional products for the elderly will be a lasting movement rather than a short-term trend. This makes nutritional products for this group a good area to invest in for a long-term return. The world's population over 65 years will double from 8% to 16% in 2050. An aging population faces many health issues: physical frailty, dysphagia, diabetes, chronic kidney disease, digestive tract disorders, cancers, the complication of hospitalization in general, to name only a few. Let's illustrate one side of this demand, the healthcare sector. Well, for 1 in 4 hospital patients is malnourished. Malnutrition increases hospital stays up to 75%. There are several ways for the hospital to improve the patient's nutrition. One is through nutrition products that are administered by feeding tube or intravenously. Another is orally, especially using a drink like a high-protein ONS. ONS drinks have the advantage of being both effective and less invasive. This makes them ideal for patients who are able to eat and drink some foods, but not enough to get all the nutrition they need. Providing ONS to the malnourished patients not only improves their comfort and quality of life, but it can reduce the cost of hospital care by 12%. These patients and the elderly or ill in general often have physical difficulty with swallowing. So, an ONS has to provide the protein quality to fill their nutritional needs, but it also has to be pleasant and easy for the patients to drink. What does all of this mean for the dairy industry? Well, NIZO has found that dairy-based proteins are the best option for these products. Given the scale and long-term potential of the market, this makes ONS drinks a very interesting opportunity for dairy producers and product manufacturers. Why are dairy proteins preferable? They are a main option for use in ONS in plant-based protein. So let's compare the dairy and plant proteins, starting with the protein quality. There are 2 different ways to score protein quality: the Protein Digestibility Corrected Amino Acid Score, or PDCAS, and the Digestible Indispensable Amino Acid Score, or DIAS. Both are based on digestibility and quantity of essential amino acids for providing the proteins in the correct ratios for human consumption. Essential amino acids are those that the body cannot synthesize on its own and must be retrieved from the diet. While PDCAS is still the official standard, both for the FDA and the Food and Agriculture Organization of the United Nations and WHO, the DIAS offers a more accurate representation of amino acid digestion and absorption. The FAO recommends that to make a nutritional claim of being a good source of protein, a protein must achieve a DIAS score of 75 or above. To be categorized as excellent source of protein, it must have a DIAS score of over 100. Note that none of the plant-based proteins achieve a DIAS score of over 100. Regardless of which score is used, all of the dairy proteins, including milk protein concentrates, whey protein, and casein, perform better than or equal to the highest scoring plant-based proteins. Overall, dairy proteins offer higher essential amino acid content, better digestibility, and higher mineral content with relatively higher absorbability. In NIZO's in vitro research into digestibility, we compared several common plant-based proteins with both whey protein and casein. We found that the whey proteins considerably outperform the plant-based proteins for protein digestibility. Looking beyond protein quality, dairy proteins are also the best choice in terms of processing and ingredient interaction. And why is this a significant issue? I can illustrate the challenge with two products that are actually on the market. You can see that for 100 ml of product A, it provides this amount of nutrients. In normal diet, that's the equivalent of 32 grams of sugar, 6 grams of oil, and 29 grams of meat, for a total weight of 67 grams. Product B, on the other hand, provides this amount of nutrients. And that equals 24.4 grams of sugar, 9.4 grams of oil, and 46 grams of meat, for a total of 80 grams. How do we fit all of that into 100 milliliters? We will need an intricate combination of a large number of ingredients that are put through complex processing steps, starting from dissolution, emulsification, heat treatment, and filling. There can be as many as 30 ingredients to provide the nutrients that are needed for medical nutrition. But the interactions between all of these ingredients, as well as the processing conditions, including pH and heat treatment, can affect the behavior of the protein. And that impacts key product characteristics such as stability and viscosity. I will illustrate this with technical information that is related to the development and manufacturing of the ONS, but the issues are very similar for developing and producing the dairy protein ingredients. NIZO can provide any additional information and support you need. We carried out a trial of an ONS prototype with this composition. And we found that with the plant-based protein, a pea protein isolate in this case, the viscosity of the drink was much higher than with any of the dairy-based proteins. We also found that the particle size distribution of the ONS prototype with plant protein showed a bimodal pattern with big particle size. This indicates the formation of protein aggregates, which could be the main cause of the high viscosity. Interestingly, the particle size with the casein-based proteins, both micellar casein isolate or MCI, and sodium caseinate, was smaller than the whey-based protein or WPI, whey protein isolate. I will come back to this. NIZO also observed the behaviors of the different proteins based on the pH. pH influences how proteins behave and interact under heat treatment. This effect is more apparent in products with higher protein content. So, for high protein ONS, it is very important to choose the right pH and heating conditions. Dairy-based proteins again proved to be a better choice, as they have a much lower viscosity at the same pH compared to the plant-based proteins. And the casein-based protein again performed better even than the whey-based protein. So, while I showed earlier that whey is the most digestible protein, this viscosity illustrates why digestibility isn't the only consideration. You need to look at the entire picture. To determine which dairy-based protein is the best for the ONS drinks, NIZO carried out investigation into behaviors of each. Specifically, whey denatures under heat and forms aggregates or gels. Casein, on the other hand, does not denature and is quite heat stable due to the electrostatic repulsion and static hindrance. It only starts to aggregate at really high concentrations. However, when using a dairy protein that contains both whey and casein, for example milk protein isolate or MPI, the presence and denaturation of the whey protein can trigger casein aggregation, and this results in a viscosity that falls somewhere between that of a product using whey alone or casein alone as a protein. We see this in practice with our ONS prototypes containing several types of dairy proteins. When heated, the product containing whey protein gelled at 10% protein concentration. The product containing milk protein isolate stayed liquid longer, but finally also gelled at 12.5% protein concentration. Only product containing MCI remain liquid at this concentration. Even here, not all caseins behave the same. For example, sodium caseinate intrinsically has a higher voluminosity than micellar casein, and this results in a higher viscosity. Furthermore, the composition of the MCI can vary. You have to be sure that as an ingredient in your ONS, it meets certain requirements, including regulations and standards in different markets. Let's take the example of an ONS drink that will deliver 240 kcal energy for 100 ml of drink, and that will be sold in Europe. MCI that we use has this nutrient composition. However, as the protein concentration goes up, the ONS risks exceeding European guidelines for calcium or phosphorus content. This is a really important consideration both for the producers of the MCI and of the ONS itself. There are of course ways to adapt the mineral concentration of a protein to make it better suited for use in medical nutrition, and that is certainly something NIZO is available to assist you with. So NIZO's research has made clear that casein, and especially MCI, is the best option for a high-protein ONS that provides the needed nutrition in a pleasant, drinkable form. Again, keep in mind that we are specifically looking here at high-protein ONS. The best dairy protein for your product will depend on what kind of ONS you are developing. As we will see, MCI can be tricky to handle in processing, and solving one issue can create another one. I have already discussed MCI's flexibility, especially in terms of its resistance to denaturation, unlike whey protein. However, its flexibility also means it can easily be affected by different processing steps. For example, it can be sensitive to high heat and calcium. MCI is naturally high in calcium, which is very important for its structure to provide low viscosity in a product. However, it is detrimental to its heat stability. High protein levels increases the concentration of calcium ions, which then screens the negative charge of the protein. This then reduces the electrostatic repulsion between the proteins, decreasing their proximity to one another, and finally triggering heat-induced aggregation. Furthermore, intense heating causes the dissociation of kappa casein, and this exposes the rest of the calcium-sensitive caseins, which thus begin to aggregate from the heat. To increase the heat stability, we can use citrate. The citrate chelates the free calcium, preventing it from interacting with the proteins. As a side note, citrate also helps to prevent calcium-induced aggregations for other types of dairy proteins, and not only just MCI. However, we need to be aware of the challenges raised by adding citrate. For instance, too much citrate concentration can create viscosity and stability issues. This is due to the chelation of calcium from the calcium phosphate nanocluster. The calcium phosphate nanocluster acts as a sort of glue that holds together the structure of the casein micelle. The chelation causes the micelle to dissociate, which increases its volume and thus its viscosity. Too much chelation of calcium by citrate can also result in a supersaturation of calcium citrate. This can cause crystals in the ONS drinks, which consumers don't like. So, to summarize, there is no single formula for developing an MCI or an ONS. With so many interacting ingredients and processing considerations, in practice, it is in many ways an art, but an art informed by science. This isn't a quick economic win. It requires careful and thorough development, guided by an in-depth knowledge of food, nutrition, dairy proteins, and science. We at NIZO are happy to help you with this. With a well-designed and well-considered approach, we are confident that the long-term and wide-ranging market for this value-added dairy application makes both MCIs and ONS drinks a very interesting opportunity. Thank you very much for your time and attention today. If you are interested in the potential of either dairy proteins or oral nutritional supplement drinks, I invite you to contact us at NIZO. We will be pleased to discuss the possibilities with you and help you develop your approach to this interesting market.